Welcome back. This month, people across the country are raising awareness about colorectal cancer, a disease that affects men and women alike, but it is preventable in more than 90% of the cases. Now, joining us today with steps on how to lower your risk, welcome Dr. David Flores from Endoscopy Center. Thank you for joining us.
Thank you for your time.
Now, let's talk about this because, you know, this is a big thing. People do not want to get tested for this for some reason. Now, let's get into what the symptoms are and what this cancer does to the human body.
Well, first off, I'd like to say one of the major problems with colon cancer is that once a patient has symptoms, the disease may be advanced. So the cat is sort of already out of the bag, if you will. So that's one thing, the reason why we encourage people to be screened early so that they do not develop advanced disease and therefore have symptoms.
And what's a good age for that?
We usually start at age 50 unless there's a family history of colon cancer or polyps within direct siblings or mother and father.
Now, what group is most at risk for this?
Everyone is at risk
Everyone.
for this condition. There are some folks who have chronic illnesses such as Crohn's disease or ulcerative colitis who are at a higher risk than the average population. But in general, everybody after the age of 50 should have colon cancer screening. The other group would be people with a direct family history of family members.
If it's in your family, definitely something you need to look into as far as getting tested. Now, why do people put off getting screened for this?
There are several reasons. Number one is that it is what we call the silent killer. So most people are not aware that they are developing colon cancer that is growing within the body until, again, like I said previously, until symptoms have developed. The other is the bowel preparation and fear of uncomfortableness of the procedure and things of that nature. So that's one of the reasons we're out trying to promote people getting screened so we can dispel some of the myths about colonoscopy.
Sure. Now, what are some of the warning signs that people should be looking for?
Okay, any type of intestinal bleeding would be of great concern. Abdominal pain, unexplained weight loss. There's also anemia, which is low blood counts within the bloodstream, which are indicative of potentially a colon cancer that is bleeding into the intestines that you're not aware of.
Okay, now if somebody wants to get checked, now they go to their doctor, what does the screening entail?
Basically, the bulk of the work occurs with the patient the day prior. They would be on a clear liquid fast, which means broth, juice, and jello. As well, they are prescribed a laxative, which will induce a bowel purge so that the colonoscopy can be done and the intestinal lining can be examined. Then they would come in, for example, to our center. They would be sedated by a team of anesthesia providers, so there's no pain, discomfort, or anxiety during the test. And while they're sedated, we would examine the colon lining with a lighted tube and camera and remove any polyps or precancerous growths that we encounter.
Okay, definitely something very important. Now, is there somewhere a website that people can learn more about this, something that you recommend to read up on this, to learn about it, and then possibly go get screened?
Of course, there's the American Cancer Society, which has different websites for all the different types of cancers that people may unfortunately be diagnosed with. Our website is elmsdigestiveddisease.com. You can Google my name or Google Elms Digestive, and we will come up, and you can investigate further on our website. We have a lot of frequently asked questions that patients can get involved with before coming to see us.
All right, Dr. Flores, thank you so much for stopping by, and definitely something our viewers should look into, especially if they're getting close to, like you said, age 50.
Right.
All right, thank you so much for joining us today.
Thank you.
All right. And still to come on today's show, we'll be shedding new light on how folks suffering from psoriasis can dress to impress this spring when we talk with Project Runway's Tim Gunn. That's next.